Welcome to the deep dive. We're jumping straight into a really critical topic today, alcoholic liver disease, or ALD. Definitely something you need a solid grasp of, whether for exams or just general medical knowledge.
Absolutely. And our mission here is to, extract the most important high-yield stuff about ALD from the revision notes we're looking at. Make it clear, concise, memorable.
Yeah, because it covers quite a spectrum, doesn't it? You've got the alcoholic fatty liver disease, then alcoholic hepatitis.
And potentially leading right up to alcoholic cirrhosis.
Yeah.
It's a progression.
It can feel a bit dense, I think, but we'll try to break it down. We've even got some mnemonics and memory tips lined up.
Sounds good. So where should we start? Definition.
Yeah, let's kick things off there. So ALD, what are we actually defining?
Okay, so simply put, alcoholic liver disease refers to a whole range of liver problems. And the key thing is they're caused by drinking too much alcohol over a long period.
Right, and it covers those three main stages we just mentioned.
Exactly. Fatty liver, alcoholic hepatitis, and cirrhosis. It's really important to remember it's generally a progressive condition. Things tend to get worse if the cause isn't addressed.
Okay, so it progresses, and the cause, the etiology, I guess that's pretty straightforward.
Well, yes and no. The primary cause is definitely chronic and excessive alcohol consumption. That's the main driver.
But it's not just about how much someone drinks, is it? I remember reading there are other factors.
That's right. While heavy, sustained drinking is number one, other things contribute. There are genetic factors. For instance, some people's bodies just handle alcohol differently.
Okay.
Gender also plays a role. Women generally seem to be more susceptible to liver damage from alcohol compared to men, even at lower levels of consumption sometimes.
Interesting.
And then there's just individual variation. Some people develop problems more readily than others, even if their drinking patterns look similar on paper.
Right, that makes sense. So drilling down into risk factors then. Heavy and prolonged use is the obvious big one.
Absolutely number one. But don't forget binge drinking.
Ah, right. That's significant too.
Very significant. Even if someone isn't drinking heavily every single day, repeated episodes of, really heavy binge drinking can put a lot of strain on the liver and cause damage.
Okay. And the other factors we mentioned?
Yeah, they count as risk factors too. So that genetic susceptibility we talked about, malnutrition can make things worse, obesity as well.
Right.
And having another liver issue already, like say viral hepatitis, especially hepatitis C, that can definitely increase the risk if someone is also drinking heavily.
Okay, so a multifactorial picture, even though alcohol is the main trigger. Let's get into the mechanics, the pathophysiology. What's actually going on inside the liver?
Okay, so it starts with the chronic alcohol abuse. The liver is working overtime to process the alcohol, and this process creates harmful byproducts.
Like toxins.
Sort of, yeah.
Okay.
They cause inflammation in the liver tissue and something called oxidative stress, which is basically an imbalance that damages the liver cells, the hepatocytes. And this constant damage, this ongoing assault, if it continues, it leads from that initial stage, the fatty liver where fat just builds up, to alcoholic hepatitis. That's where you get more significant inflammation, cell damage, maybe some early scarring.
Okay.
And if that continues, you get more and more scar tissue forming, that's fibrosis. And eventually that fibrosis can become so extensive and distort the liver structure that you reach cirrhosis.
Which is the really serious, often irreversible stage.
Exactly. The structure is permanently damaged at that point.
Okay. Now, if someone comes in with, potential liver problems, it's not automatically ALD, is it? We need to think about other possibilities, the differentials.
Absolutely crucial. You always have to consider other conditions that can look similar. Viral hepatitis is a big one, especially hep C.
Right.
Non-alcoholic fatty liver disease, NAFLD.
Yeah.
That's really common now, often linked with obesity and metabolic syndrome. It can look very similar on tests sometimes.
Okay. What else?
Drug-induced liver injury. Lots of medications can affect the liver. Autoimmune hepatitis, where the body's own immune system attacks the liver. And then rarer things like hemochromatosis, that's iron overload. So yeah, a broad differential is key.
Definitely. So thinking about the UK context, how big a problem is ALD here? What's the epidemiology like?
It's a major public health issue in the UK, unfortunately. It accounts for a really significant chunk of liver disease and liver-related deaths.
How significant?
Well, the statistic often quoted is that around 80%, 80, of liver-related deaths in the UK are linked back to alcohol.
Wow, 80%. That's huge.
It really is. And, the prevalence, how common it is, closely mirrors patterns of alcohol consumption in the population.
Right, which underlines why understanding it is so vital. Okay, so clinical features. How does someone with ALD actually present? What might you see?
It's really variable. That's the first thing. In the early stages, like simple fatty liver, people might feel completely fine, no symptoms at all.
Or maybe just vague things.
Exactly. Maybe a bit tired, some vague discomfort in the upper abdomen, but nothing specific.
But as it progresses,
As it progresses, more obvious signs tend to appear. Things like persistent fatigue, losing weight without trying, jaundice, that yellowing of the skin and eyes.
okay.
Abdominal pain or swelling can happen, ascites, that's fluid building up in the belly.
Right, I've seen that.
And in severe cases, hepatic encephalopathy. That's where toxins build up because the liver isn't clearing them, and it affects the brain, causing confusion, changes in personality, drowsiness.
That sounds serious.
It is. But it's important to remember, again, these symptoms aren't unique to ALD. They can overlap with lots of other liver conditions.
So that brings us back to needing proper investigation, right? If you suspect ALD, how do you confirm it and see how bad things are?
Right. Investigations are key. We'd start with blood tests, a full blood count, and definitely liver function tests, LFTs.
What are you looking for in the LFTs specifically?
Well, you're looking for signs of liver inflammation or damage,
Hmm.
but a couple of markers are particularly helpful for ALD. Gamma GT, or GGT, is often very high.
Okay.
And then there's the ratio of two other liver enzymes, AST and ALT. In ALD, typically the AST is higher than the ALT. The AST-ALT ratio is usually greater than 2.
Greater than 2. Is there a memory aid for that?
Yeah, couple actually. You can think alcohol stresses the liver more than ALT. To remember, AST is usually higher. And for the ratio, think A Scots, 2-3 whiskeys.
Ah, okay. So over 2 is suggestive.
Right. And if that ratio is actually greater than 3, that's a strong pointer towards the acute alcoholic hepatitis phase.
Got it. 2 or 3 whiskeys. Okay, what else besides bloods?
Imaging is important too. An ultrasound of the abdomen is usually the first step. It can show fatty liver, size, signs of cirrhosis, or portal hypertension.
CT or MRI sometimes.
Yeah, CT or MRI can give more detailed pictures if needed. And in some cases, especially if the diagnosis isn't certain or you need to know the exact stage of damage, a liver biopsy might be done.
Taking a small sample of the liver tissue itself.
Exactly. But probably the most crucial investigation, honestly.
What's that?
A really thorough history of the patient's alcohol consumption. You absolutely need to quantify how much and for how long they've been drinking.
Makes sense. You can't diagnose ALD without knowing about the alcohol. Okay, so you've done the tests, confirmed ALD. How do you manage it?
The absolute #1 most critical part of management at any stage is stopping alcohol completely. Abstinence.
That's non-negotiable.
Pretty much.
Okay.
It's the only way to stop the damage from getting worse and give the liver a chance to potentially recover, especially in earlier stages.
Okay. Stop drinking. What else?
Supportive care is vital. Good nutrition is really important. Many patients are malnourished. Treating complications if they arise, like draining ascites or managing encephalopathy.
And addressing the alcohol problem itself.
Absolutely. That involves support for alcohol dependence counseling, support groups, maybe rehab programs, sometimes medications to help with cravings or withdrawal.
And for the most severe cases.
If the liver damage is very advanced, irreversible liver failure, then liver transplantation might be an option for carefully selected patients who remain abstinent.
Okay. What about specific treatments for that acute phase? Alcoholic hepatitis. You mentioned steroids.
Yes, for severe acute alcoholic hepatitis, glucocorticoids like prednisolone are often used. They can help reduce the severe inflammation in the liver.
How do you decide who gets them?
There are scoring systems to help predict severity and who might benefit most. Maddrey's discriminant function, or DF, is a common one. It uses prothrombin time and bilirubin level. A high score suggests severe disease where steroids might improve short-term survival.
Okay, Maddrey's DF. Is there anything else used?
Pentoxifylline has been used as an alternative, sometimes in patients who can't have steroids, but a big trial called the STOP-AGE study compared prednisolone and pentoxifylline.
And what did STOP-A find?
It found that prednisolone improved survival at 28 days, whereas pentoxifylline didn't really show a significant benefit. So if steroids are generally preferred, it's indicated and safe.
Good to know the evidence there. So thinking about the longer term, what's the prognosis like for someone with ALD?
It's really variable. It heavily depends on the stage of the disease when it's caught
Okay.
and how much damage has already been done. But the biggest factor influencing prognosis is...
Whether they stop drinking.
Exactly. Achieving and maintaining abstinence is key. If someone stops drinking, especially in earlier stages, the prognosis can be significantly improved. The liver has some capacity to regenerate.
So early intervention and stopping alcohol are positive signs.
Definitely. But if someone continues to drink Or if they already have advanced cirrhosis with complications, then the prognosis is unfortunately much poorer.
Right. And what kind of complications can develop if ALD progresses?
Well, the most direct ones are worsening liver function, progressing to full-blown cirrhosis if it wasn't there already, and eventually liver failure.
Where the liver just can't do its job anymore.
Correct. Then you get complications related to the high pressure in the liver's blood vessels. That's portal hypertension.
And that leads to...
That can lead to things like ascites, the fluid buildup, and also esophageal varices.
Ah, the enlarged veins in the esophagus. The memory tip.
Yeah, I think varicose veins in the throat, they're dangerous because they can burst and cause massive bleeding.
Scary. Any other major complications?
Yes, there's a significantly increased risk of developing liver cancer, hepatocellular carcinoma,
Right.
particularly in people with cirrhosis from alcohol.
Okay. Cancer risk too.
Plus, patients often have a weakened immune system, so they're more prone to infections. And you can see associated problems like pancreatitis, inflammation of the pancreas, and increased risk of cardiovascular disease as well. It affects multiple systems.
Wow. Okay. So wrapping this up then, the key takeaway seems to be that ALD is, well, a really serious outcome of drinking too much alcohol. It's a spectrum. Presentation varies.
But the absolute crucial things are early recognition, considering it in the differential.
And the necessity of stopping alcohol, that seems like the cornerstone for improving the outlook.
Absolutely. And using the right investigations to confirm things and assess severity.
This has been a really thorough, high-yield deep dive. Thanks for breaking that down. It really makes you think, though. Considering the massive impact of alcohol on liver health, what broader, maybe societal changes could actually help with earlier intervention or even prevention of conditions like ALD? Something to ponder.
Definitely food for thought. And for anyone listening who wants to cement this knowledge or explore other topics for medical exams, especially the MSRA.
Yes. Do check out PassTheMSRA.com.
And also FrontsRSRA.com. Both have excellent resources for revision.
Great suggestions. Thanks again.